Welcome viewers to this week's edition of Health Corner. Today we're going to talk about a new topic we've not discussed before. This is regarding joint and bone problems, especially among the ethnic minorities in the United Kingdom. But this affects all ethnic minority people across the world. So today we have the privilege to have in our midst a renowned specialist in rheumatology who is a professor in the United Kingdom. Welcome to Health Corner, Professor Chakravarty.
Thank you for asking me to come.
Prof, viewers must be keen to hear you speak because you've done a lot of research in this area. You are renowned and all your work has dated back many years. I'm very, very happy and I'm sure viewers will be excited to listen to what you have to tell us today regarding joint and bone diseases among the ethnic minorities and the work you've done in the UK around this. You're welcome to the program.
Thank you very much. I think we all know that there is a huge problems in patients who actually come from minority population for a large number of reasons, and sometimes there are often described as lack of communication issue. But sometimes it is also the lack of time on the part of the professional to give enough time to listen to the patient's problems. And because of the divergent language used and medical terminology used, it leads to a lot of confusions to the patients in the long run. So their management gets confused and they don't lead a normal healthy life as you expect in the local population.
Yes.
Because of the partly due to language problems. But having said that, there are also original problems which are embedded within the system which requires to be looked at. And that is why since 2000, there has been a project of developing health assessment for BME population in multi-ethnic groups in the United Kingdom. And I was fortunate to be part of some of it, and that's what main emphasis on. But my major emphasis will be on the arthritis and joint pain and how to distinguish between the two and how to address those issues and take it up at the right time to the general practitioner so that they can be addressed in time so that deterioration or damage to the joint or any other musculoskeletal system.
Extremely important. Thank you very much. Yes. Okay. Yes. So, right. I know you've done quite a lot of work. Viewers are listening. So, if you tell us a little bit about what you've done around this, that would be very, very welcome.
We did a lot of research in general multi-ethnic minority in ethnic minority rich areas of United Kingdom like Leicester, London, Barnsley and all that, Sheffield. And there was some disparity in the provision of care or delivery of care to the minority population. And that can be analyzed in various ways, why there was a disparity and what could have been done better. And actually we published that in the literature already, one of the general practitioner journals some years ago. And also in universities we published and presented in conferences. So you can understand that it is not unique, it happens to now, more importantly, because of the United Kingdom being now of course going to come out, but previously it was part of the European Union.
Yes.
So ethnicity is not just a color. It is not due to what color of your skin you have. Even within the white population there are ethnicity issues. And as I said, the determinants of health may differ between ethnic groups, not only between different population structures of groups and genetics, but also cultural, generational and socio-economic with differential impacts on life. And I think that is what is the main issue, and the prevalence of the illness and health related between behaviors between these groups can be very different, and this will affect the balance of services that you provide for these patients in the long run. So I think it is very important to identify the different ethnic groups and their different problems, both socio-economic, cultural and behavioral issues and how they perceive their illness and how it affects their quality of life. So it is very important that it is a professional's job to actually identify that, of course with the help of other colleagues and health care providers. But at the end of the day, it is very important to know what are the issues that actually impacts the quality of life of this minority population in which way. Pain is one of the presentations of any illnesses in majority of the case. And the common ailments that actually affect the ethnic minority, I put it in a alphabetical order, but it is not arthritis predominantly, but they, as you know, in ethnic, but particularly BME population, diabetes, heart disease, hypertension, these are the major causes. And then if you go into the rheumatological aspect, then it comes lupus and scleroderma and all these conditions, which are very complex conditions. They also affect the Afro-Caribbean or Asian population quite a lot, particularly lupus affects the South Asians. So I think these are the major, I've classified them as the major conditions that ethnic minority populations suffer from. And of course, cardiovascular issues including high blood pressure and strokes are related, and heart failure. So I think it is important to address those issues, and one has to think very carefully that one can have one disease as a predominant presentation like arthritis, but they can also have comorbid conditions like diabetes, cardiovascular disease, airway disease, chronic obstructive. So these come in as a pari passu with the management of the whole patient. So joint pain is not on its own entity, but it has to be part of the whole management process. So we can actually see the patient, examine the patient, and make a thorough assessment of what is the cause of the pain that the patient is presented with. So if it's a localized pain in a joint, in one joint or more than one joint or multiple joints, more than 4 or 5 joints, then they are classified medically into various types of joint disease. And if it is associated with features of inflammation, then you call them arthritis. So joint pain can be present, has to be present in all patients with arthritis, but all joint pains are not necessarily arising from arthritis.
That's correct.
So that is a very important differentiation, and it is very common in all types of people, and it affects, it is less common in minority population, but their pain presentation is probably due to other causes like associated diabetes and other conditions, sometimes related to drugs. And back pain is not very common in ethnic minority, but generalized aches and pains are not uncommon. It's very common, and there are lots of papers published on this in the UK. The pain perception and pain presentation to the professionals from minority population is very, very significant. Maybe their perception of pain and expression of pain is different, or management of pain. So in summary, if I go into the issue about arthritis, we have to understand that all joint pains are not arthritis, but arthritis cannot be there without any pain in the joints. Now the features of arthritis by definition is that you have signs of inflammation there, and medically, as you know, that there should be some features to suggest pain associated with stiffness and swelling, and besides that patients may complain of generalized unwell-being, having lost weight or having lost sleep, and generalized feeling of unwell-being, and loss of appetite can be an associated feature. But clinically for doctors, you have to understand that are there any features of inflammation like calor, rubor, dolor, tumor, and loss of functions? And these are the clinical assessment of the patient. But patients do not come and tell me, I've got calor or dolor, etc. But they say just pain. So then it is the professional's responsibility to make sure that there is features of inflammation or there is no feature of inflammation. If the patient hasn't got any feature of inflammation, then your course of management will be slightly different from a patient who has got obvious evidence of swelling, stiffness, and pain. Now there are different causes for painful joints. One can be due to the features, as I suggested, inflammation, and sometimes it can be purely unrelated to inflammation because of wear and tear or degenerative arthritis. Now if you look at this population of patients, usually middle-aged or elderly, you find them that they develop deformities of the fingers or hands, and that is predominantly because of wear and tear, or what we call as osteoarthritis. But if you look at their x-rays, you may find some deformities or degeneration, but you won't find such damage as you see in other inflammatory arthritis like rheumatoid type disease. So one has to be very clear in primary assessment of the patient. Is it inflammatory or non-inflammatory? If it is not inflammatory, then you can follow one course of action. And if it is inflammatory, you have to follow a different course of action.
Right.
And that depends on the severity of the disease and the population you are treating.
Yes.
So in order to treat an inflammatory arthritis, you have to know whether it is rheumatoid arthritis,
Yes.
or is it another type of called seronegative inflammatory arthritis, or is it connective tissue disease where the patients may present with the same symptoms, pain, stiffness and swelling and loss of function, but completely different cause.
Yes.
The cause of the condition is different.
Right.
So in case of inflammatory arthritis, you have to understand the prototypic disease is rheumatoid arthritis, which is usually symmetrical in both hands and feet, and then it can affect any organ in the body.
Right.
So I've just showed you some evidence of that they can develop nodules under the elbows and sometimes can develop problems in the lung and heart, and also deformities which are classically described in the textbook as by names. But that more importantly, it is important in the 21st century that we should intervene much before
Yes.
the deformity occurs.
Right.
Because if the inflammation is allowed to continue, then that will cause severe deformity and loss of function and the quality of life for the patient.
Right.
So that is where we as clinicians have to be prompt in making that diagnosis of whether it is inflammatory or whether it is non-inflammatory.
Right. Prof, oh, this is fantastic. But if we're looking at the picture, I know IA, the viewers might be wondering what is IA. That is inflammatory
Arthritis. IA stands for inflammatory arthritis,
Right, okay.
and OA stands for osteoarthritis generally.
Okay. Yes.
And this rheumatoid arthritis is perhaps a misnomer. It should be called rheumatoid disease,
Right.
because in majority of our practice, about 30 to 40% of rheumatologists in a district general hospital often see this inflammatory arthritis, and they can quite rarely and commonly present with deformities at a later stage. So the government had taken, and the patient support group called National Rheumatoid Arthritis Society, they took a real decision that we should be making people aware that this is inflammatory arthritis. You should sit on it, and you should see your GP, and the GP should refer the patients within a period of 3 to 6 weeks for a second opinion.
Oh, that's very informative, Prof. Thank you very much. This is the first segment. Viewers, you've heard the Prof is just giving a background on the inflammatory arthritis. You can see the information he's giving us. It's what from his research and his experience. So we're going to take a short break. We'll be back to talk more on rheumatoid arthritis and other examples.
Health Corner on Ben TV by Crystal Life is an exclusive show that explains different health conditions which you may not hear from your doctor. Health Corner elucidates your health in simple, understandable language, preventing you from getting ill. It explores different health issues and looks at health practices in the UK and other countries. For the educative and innovative medical show by Crystal Life.
Meet Anne. Anne is thinking about sending goods to Africa. Her first thought came to MDS Cargo. Send goods to Nigeria, Ghana, and many more countries in Africa. Excellent customer service and after-sales support. Free London and Essex collection. Online tracking.
Fast Cargo caters for all your door-to-door sea and air cargo services from Nigeria to the UK and UK to Nigeria. With prices from 99p per kilo, you can't go wrong. For prompt, efficient and dependable service, call Fast Cargo today.
Health Corner on Ben TV by Crystal Life is an exclusive show that explains different health conditions which you may not hear from your doctor. Health Corner elucidates your health in simple, understandable language, preventing you from getting ill. It explores different health issues and looks at health practices in the UK and other countries. For the educative and innovative medical show by Crystal Life.
Welcome back to the second segment of Health Corner. Today we're talking on inflammatory arthritis, or in fact, joint and muscle pain in black and ethnic minorities. And we have the privilege to listen to Professor Chakravarty, who is a professor of rheumatology in the UK. Prof, I know the next one will be rheumatoid disease. Yes, what actually is rheumatoid disease?
Well, we have been mentioning about arthritis as a presentation of presenting a joint pain. But rheumatoid arthritis is not actually one joint condition. It is multi-system disease, and it can affect your heart, lung, kidneys, skin, eyes, lots of other things. So there is some pictorial presentation of the disease itself, because when we call it disease, that means it is a systemic illness. That means it affects our whole system. But when you call it just arthritis, it may be that one joint is affected or a couple of joints. So rheumatoid arthritis has been perhaps misnamed as rheumatoid arthritis. It should be called rheumatoid disease. And as it can affect the lung, as you can see in one of the slides there, the rheumatoid nodules used to appear in the lung as well and misdiagnosed as cancer. So I think it is very important to recognize that it is not just one disease, but it can affect multi-system illness, and it can also affect the children. So it is important to recognize that rheumatoid arthritis or similar sort of inflammatory arthritis can affect children, and if that happens, then obviously you have to quickly and promptly get opinion about the treatment from a specialist, wherever may it be. Particularly, it is no point ignoring the fact that children, if they get the disease and they can't walk, and they have got problems in the knees or wherever weight bearing joints, their growth will be retarded due to the problems with the symmetry of the joint. So I think it is very important for the family to recognize that if they have got any symptoms of pain, stiffness, swelling, and loss of function of a joint in a child, to take it to the general practitioner and look further. So joint pain is not uncommon, it's very common. And most pains are not necessarily due to inflammation of the joint, but one has to be able to decide whether it is due to inflammation or not. And as I said, look for signs of stiffness and swelling. It is really good for general people, mother and parents and family, and also the general practitioner. But most importantly, the alarming signs of problems in relation to children is the presence of fever, sweating attacks, and skin rash. And that is, in general, is a particular type of syndrome, and that needs a quick attention from medical practitioners to control that condition. It's called Still's disease. So arthritis is not, inflammatory arthritis is not the commonest. Osteoarthritis is the commonest form of joint disease, which is seen predominantly in the middle-aged and elderly. But having said that, inflammatory diseases, particularly when it affects the young and the children, we have to intervene quickly. There are many other arthritic conditions which I haven't mentioned so far. One of them is association. As I said, you have to look at comorbid conditions like psoriasis, diabetes, and all these things, and you have to be careful that what other comorbid conditions are there which are maybe a clue to the underlying diagnosis of the joint pain. So that is one thing. And obviously any patients with arthritis will have some signs of inflammation by swelling in the joint, and this is the problem. When you don't diagnose it early, it can progress quite rapidly, and then it leads to damage. So in a sense, we have to make the diagnosis pretty quickly and intervene with treatment. That is the segment of inflammatory joint disease. Now I'm talking about symptoms of osteoarthritis, if you want me to say that, and that is again joint pain. The patient presents with joint pain, bony swelling, but not due to inflammation. Sometimes they may have very minor signs of inflammation, and then at the end of the period, they may develop quite quietly loss of function and significant disability. So these patients are also important to be carefully checked out. And if you look at their examination of the hands, you'll find some changes in the distal joints of the fingers, and if you x-ray them, you'll find some damage as well. But they are very different from the rheumatoid type of arthritis, where you find destruction of the joint, which leads to complete deformity and dislodgement of the articulation. So these are the usual difference between osteoarthritis and rheumatoid arthritis. But there are classical symptoms of rheumatoid arthritis which we have just discussed about: pain, stiffness, swelling, loss of function, and disability. And sometimes rheumatoid arthritis can produce extra-articular feature. Extra-articular means anything that is beyond the joint. So joint pain and stiffness is a presentation, but gradually over a period of time, they may develop some lump in the elbows or other pressure points, which we call as rheumatoid nodules.
These are nodules. Okay.
That's right.
That's a picture of a nodule.
That is a picture of a nodule. Now, classical deformities of hands in patients with rheumatoid arthritis, you can see here, that swan neck deformity, and this is because of the subluxation of the joints and leads to complete loss of grip power. And this is what we try not to happen in patients with rheumatoid arthritis. And this is why the early recognition and early intervention leads to prevention of that deformity and maintenance of normal or natural function of the quality of life. So as a rheumatologist, we deal with these conditions of arthritis, but at the same time, we deal with many other conditions such as soft tissue rheumatism like tennis elbow, Wolfer's elbow. And at the other end of the spectrum is a severe illness and characterized by sometimes fatality, which is called vasculitis or large vessel disease, as it's shown in this patient.
Right. So, Prof, can I ask you, some people in some cultures and in some countries, when they have joint pain, they say, "Oh, I've got rheumatism." What the heck? It's a very confusing picture. I know in certain countries, when it's cold season, they have lots of joint pain and stiffness, and they say, "Oh, that is rheumatism." The word rheumatism is not just synonymous with arthritis. I mean, yes.
You're quite right. Rheumatism is a layman's term. When patients or people go through pain, aches and pains in joints or muscles, they say, "I'm probably going through rheumatism." But that rheumatism may be truly just nothing more than just benign pain, nothing related to any arthritis. But it is very important to be checked out, to make sure, depending on what age group we are, we have to get your blood test done and x-rays done or whatever relevant is necessary, depending on the findings on examination. So I put this slide up just to show that clinical symptoms, how you present to your patient depends on your control of the language and also how you feel culturally, how you can express yourself to the doctor professional. So it depends various patient to patient. Even in the general local population, there, depending on the education and everything, you do see different groups of presentation. And I think it happens in minority very often, depending on which culture you come from. So a lot of patients actually sit on their condition for months and years, and there are data to suggest in scientific journals that some patients sit on them, even in UK, for weeks and weeks and weeks before they report to the general practitioner that I have been getting pain and swelling. So that leads to delayed diagnosis, and that leads to complications of treatment, and that leads to functional disability. So I think overall, it is our whole holistic approach should be, patients should be aware of their symptoms and report to the healthcare professional. And then the healthcare professional should address the symptom depending on the signs and blood tests and whatever other investigations. And then with altogether, diagnosis will be achieved, whether by the general practitioner in the community or the specialist in the secondary care. At the end of the day, we are here not to make a big diagnosis or anything. We are here to support the patient through the critical time and maintain their stability and their function so that they can maintain the quality of life. So you have to address this as a general practitioner colleague. I'm trying to suggest that if a patient at 65 comes to you with a joint problem, stiffness, I know you have to you address that problem in the way you normally do. But if a 35-year-old girl comes and she's working 25 or 20, whatever, 8 hours a day, that means they're contributing to the financial economy. So you have to, when you make a judgment on intervention and assessment that who should get quicker attention, you should think about all this holistic approach, whether the patient is working at the moment, that means she's contributing or he's contributing to economy. He may have a young family to look after, because if the mother or father gets ill, then obviously the source of income goes there, and there are lots of issues. Just being a good doctor doesn't mean making a big diagnosis. So it is important to take the patient into perceptive and equation. So you look at the patient, feel where they come from, what are their cultural obligations, their social obligations, their functional obligations. Then if they have caring for, they have to look after the elderly generation, then you have to take that into account as well. So all these things together have to be taken into account when you provide healthcare for a patient, and particularly when it comes to minority population, one has to be actually able to analyze and able to spend some time with them so that they can understand where actually what does she or he is trying to mean. When they say pain, they may not actually mean pain, they may mean discomfort. You see? So it is very important to find out what exactly the pain means in a patient from different socio-biological backgrounds. And everybody says common language is pain. Oh, I've got headache. But headache may be different. You know, I can have a neck ache and I feel like headache. And some patients really have headache due to other reasons, which is important. So I think this expression of your symptom, if it is very precise and very suitable to the medical terminology, then diagnosis is very quick by the clinician.
Right. So that means healthcare professionals, they should take a holistic approach when they see people coming to them with simple or complex joint problems. But in the meantime, if you have any questions, look at the screen. You've got the number to contact us, or we can pass your questions to the professor who will answer your questions. Look at it, send us a text, look at the website, send us email. We'll be happy to get back to you. Thank you very much for giving us an insight into this problem, Professor Chakravarty, and we hope to see you next week. Thank you.
Trax Cargo caters for all your door-to-door sea and air cargo services from Nigeria to the UK and UK to Nigeria. With prices from 99p per kilo, you can't go wrong. For prompt, efficient and dependable service, call Fast Trax Cargo today.